Hi everyone, welcome back. What are we talking about today? We are going to be talking about little leaguer's elbow, otherwise known as medial epicondyle apophysitis. And this is going to be one of those teenage sporting injuries. Now, research has shown that at least 25% of baseball players aged 9 to 12 years old suffer with elbow pain, or little leaguer's elbow, which is basically an overuse injury that causes pain on the inner elbow. So you can see here the sort of basic anatomy. So you have a growth plate just on the inside of that elbow, around the epicondyle, which is that kind of knobbly bit of bone that sticks out on the end of the humerus or the upper arm bone. And it's that growth plate there that becomes inflamed due to these repetitive movements, hence causing pain. Now, little leaguer's elbow is actually a bit of an umbrella term which incorporates three, different sort of, well, not that different issues. So it incorporates delayed or accelerated growth of the medial epicondyle, which is that knobbly bit of bone on the ends that we've just talked about, medial epicondylar fragmentation, or medial epicondylitis, which is basically inflammation of that knobbly bit of bone. Now, the growth plates are still maturing during adolescence and are therefore weak and prone to injury. And you'll know this if you've seen any of my other videos about growth plate injuries in teens, such as Sever's disease, for example. Now, while medial epicondyle apophysitis, which is chronic inflammation of that growth plate, is the most common injury, there may also be lateral or posterior injury. Now, presentation is usually dependent on age. Generally, younger children, so we're talking under 10 years old, suffering with medial epicondyle apophysitis, which is the chronic inflammation of that growth plate, whereas older children above 10 years old are more prone to epicondylar avulsion fractures. So that's basically a small fracture, as you can see, on that knobbly bit of bone or the epicondyle, where it just kind of breaks away. Now, the elbow joint is comprised of three bones. So you've got the humerus, which is the upper arm bone, and then you've got the radius and the ulna, which are on the lower arm. So the ulna is the little bone that runs sort of on the side of the little finger, and the radius is the wider bone. Now, the ulna forms the medial or inner part of the elbow and creates the tip of the elbow, just this bit here. Now, the forearm muscles attach to the medial epicondyle, which is that bit on the inside that sort of sticks out, helping to stabilise the elbow when throwing, alongside obviously the ligaments in the elbow. Okay, so in this diagram you can just see the compressive and tensile forces during throwing, and obviously the growth plates, which can be inflamed, particularly in those children under 10 years old. They're the areas highlighted with the white dotted line. So we've got tensile forces and compression forces happening in that elbow. So basically what that picture was showing is that the increased tensile forces on those medial growth plates on the inside of the elbow during the late cocking and early acceleration phases of a throw result in high compressive forces on the lateral or outer elbow. An injury will occur when these forces repeatedly cause microtraumas, or sometimes they will occur just due to poor technique. Now, we mentioned there that these increased tensile forces happen during the late cocking phase or early acceleration phase. So, in case you're not familiar with these phases of throwing, so the cocking phase is where the front foot makes contact with the ground and the pitching arm abducts and extends as far as possible behind the body. The shoulder is in maximum external rotation, the elbow is flexed and the forearm supinated. Now this means that the deltoid muscle around the bulk of that shoulder, the rotator cuffs, which around the shoulder blade, and the elbow musculature are very active at this point. So that's one of the times. Then the other period is in the acceleration phase, which is where that throwing arm starts to internally rotate and adduct, which means it comes towards the body, while the elbow extends, concluding with the release of the ball. Now, at this point, a large valgus force will place a lot of stress on those medial ligaments in the elbow. So, who is at risk of developing little leaguer's elbow? Well, pitchers aged 9 to 14 have the highest risk of medial epicondyle apophysitis, and that's because those growth plates, which are cartilage, haven't toughened up, they haven't ossified yet, and that usually takes place when there's that major growth spurt around puberty. There's also a high risk in any athlete who throws overhead and has those repetitive movements. Overuse injuries affects 2 to 8% of baseball players overall, 20 to 40% of children aged 9 to 12 years old, and between 30 and 50% of adolescents. Now, an adolescent baseball pitcher who throws too many pitches too frequently, exceeding the force that the growth plate is able to withstand, is certainly going to be at risk of these microtraumas and inflammation. Certain pitches, such as a curveball or breaking pitches, will also increase the stress on the immature elbow. So this is why, you know, any sort of baseball coach in particular has to be careful about how many pitches, you know, any one child is doing. Now, so causes, we've sort of touched on causes briefly. So as we said, repeated overhead throwing with improper mechanics, lack of muscle strength and endurance is gonna result in injury. High valgus torque of the throwing motion and tensile stress on that inner elbow, repetitive traumas to the hypertrophic zone of the apophyseal cartilage or the growth plate, throwing breaking pitches and curveballs too young, and also increased pitching counts are all going to contribute towards the development of little leaguer's elbow. Now, the symptoms, generally you're going to get medial elbow pain, so that's pain on the inner elbow, inflammation, reduced throwing speed or distance, point tenderness at the elbow, effusion, which is where you get fluid moving into the soft tissues, flexion, contracture, which can be up to about 15 degrees. There may be widening and or fragmentation of the apophysis or the growth plate. There possibly may be compression growth plate injuries on the lateral or the outer edge of the elbow as well. There may also be posterior medial impingement, which is where tissues become trapped due to compression. And in severe cases, there may be avulsion fractures. And as we've said, these avulsion fractures are more common in sort of children above 10 years old. So with regards to treatment, as with a lot of these injuries, early treatment is really, important in improving the outcome, and will certainly help to reduce the risk of permanent damage or any kind of functional disability. Now, while research has shown that medial epicondylar fractures of more than 5 millimeters will generally require surgery, there has also been an argument that conservative management has similar long-term, benefits. Certainly, if this is an issue, and there is a lot of pain, you should be avoiding throwing for 4 to 6 weeks to give that growth plate a good chance to heal and for the inflammation to go down. Ice packs can also be used to help reduce the inflammation, anti-inflammatories, physical therapy to work on muscle strength and endurance, and therefore reduce the stress on the growth plate and reduce the chance of re-injury. Working on the core and hip trunk stability is also beneficial in terms of avoiding compensatory stress by the elbow. And you may also want to use an elbow extension brace if there are issues with a flexion contracture. And in severe cases, you may need to just immobilize the elbow for a while. So in terms of surgical treatment, surgery in adolescents may be advised if there are loose cartilaginous bodies which may be impeding elbow motion, if there are avulsion fractures, if there is something called osteochondritis dissecans, which is basically where bone underneath the cartilage dies due to reduced blood flow, resulting in bone and cartilage breaking away, which causes pain and restricting movement. And of course, surgery can also be used as a last resort when conservative treatment has not improved the symptoms. Now, in terms of recovery from medial epicondyle apophysitis, it's really about stopping any activity that increases the stress on the medial elbow. In early stages where pain is minimal, you may be able to just reduce the level, duration and frequency of throwing. But in severe cases, immobilization may be advised. Now, for 4 to 6 weeks, then sort of 4 to 6 weeks, after sort of you've started that recovery phase, you're looking at wrist and elbow extension and flexion, and forearm supination when pain allows. Also, elbow and wrist flexion and extension eccentric exercises. High repetitions with a low load will help to improve localized circulation during that period of tissue healing. And you can get these exercises from a physiotherapist or a sports therapist. Also, resisted elbow flexion and extension with either a TheraBand, which is like a resistance band, or cuff weights can also be done. And when these exercises can be done pain-free, You can then progress to throwing specific exercises. Now, after about 12 weeks, or sort of for the first 12 weeks, you're going to want to avoid high stress pitches. And also you're going to want to stay within an appropriate number of pitches, and your coach should be ensuring that this is happening. Also maintain a core and shoulder strengthening program throughout the year to help maintain or improve strength and muscle control. Now, in terms of massage therapy, working on the rotator cuff muscles which stabilize the shoulder will certainly be beneficial. You can also have a trigger point applied to the wrist flexors, which has been found to be particularly beneficial and effective in terms of pain relief, and also helping therefore to accelerate, the healing process. The important thing is, a lot of sort of children and teens, when they're on a sports team, they may be inclined to hide an injury or hide when they have pain, because they don't want to be excluded from the team. But it's really important that as soon as you're getting pain and inflammation, that you listen to your body and that you do take those rest periods and you do inform your coach, because if you just carry on, you're likely to make the injury much worse, and that can potentially have long-term benefits. So you do need to, just be careful with that. So that's really everything on Little Leaguer's Elbow. You can leave a comment down below. You can message me through my Facebook or Instagram. I'm on there as the Medical Massage Lady. If you are a therapist looking for training in sports injuries in teens, do take a look at my website, www.medicalmassagelady.com. I will, respond to questions. You can also subscribe to my channel. There are already various other videos on there about sports injuries in teens, and sort of issues with these growth plates. So do take a look at those, and if you subscribe to my channel, you will be notified when other videos come out. But for now, that is really it from me. So take care, and I'll see you next time. Bye.